Hi, Dr. Sam. How are you doing?
I'm fine. How are you doing?
Yeah, I'm fine as well. So, everyone who has got a heart problem, the first question that comes to their mind is, do I need to get a pacemaker? Pacemaker is kind of the easiest term everyone knows. And recently in the market, there's been a hot topic going that's all about leadless pacemaker. I believe you just performed a case at our hospital, with the leadless pacemaker, and it's one of the few cases in India. So, can you just tell me what is this leadless pacemaker all about?
So, when we start with leadless pacemaker, you have to first probably get an idea as to what a pacemaker does. So, it's basically when your heart rate is not as to how much it should be. For some reason, your heartbeat is on the lower side. To keep your heartbeat into the optimal rate, we put a pacemaker. So, the traditional pacemakers has one or two leads. It depends on what is required. And the leadless, we avoid this leads and we directly place it in the heart. It is actually as big as probably half your finger, and that's how big the device is. And we directly go place it inside your heart and it will start pacing from there. All right, so we put it in two places or a single chamber, it depends on which one we want. And the dual chamber was launched recently in India. So we did one of the first few cases in India where we put both in the upper and lower chambers and we could manage the pacing. So that's what leadless pacemaker is all about. It's about not having any wires in your pacemaker.
So how does this traditional pacemakers work, and our new thing, this leadless pacemaker, how come it is better than our traditional pacemakers?
Okay, so what we do with the traditional pacemaker, like I said, you need two leads and you have a small battery which is probably the size of your two fingers. What we do is we normally take a small cut below your shoulder, lift up the skin, take a venous access, go into the vein from there, put those two leads into your heart, in the right-sided chambers of your heart. One in the upper chamber, one in the lower chamber. And this battery is placed in your shoulder and it is paced from there. So the problem is you're making a cut. Any cut, any incision requires healing. And most of our heart patients are diabetic. They'll have difficulty healing. They might be after an angioplasty. So they have given them a lot of blood thinner so that the stent doesn't close off. And during that time, there's a chance of heavy bleeding into the pocket. There's a chance of infection in the pocket, incision not healing. In such situations, this pacemaker will cause a problem. And that is where the ease of putting a leadless pacemaker comes into picture, because it is just like how an angiogram or an angioplasty is done, where we just take one injection into your leg, little higher, little larger bore, probably little bigger injection bore, and we pass this pacemaker through a catheter into your heart, and we just place it there, pull back the whole system, and the very next day the patient can start walking and get back to the normal life. That happens. We need two machines. It depends on the indication for the patient. Either we do one or we do two. I think two was not there till a few months back. Traditionally it was always when we put traditional pacemakers, we always prefer double chamber. Now since even leadless has come a double chamber, it becomes very useful to put a double chamber leadless pacemaker. So you don't have to worry about the bleeding, you don't have to worry about the infection, you don't have to worry about anything else. So those kind of advantages are big in leadless. That is why probably if you want to call it better, that's when it becomes better.
That sounds really nice, sir. What I would like to know is why in India it is one of the first few cases, and how at Frontier Lifeline we excel at that.
So why is it first few cases? Basically this device, leadless dual chamber pacing, was launched in India in November. It's been barely 4 months. So obviously it takes time for people to get expertise and learn how to do it, because it was always done in US for the last 3 years, and it's now come into India. It's only been 3 to 4 months. So in this period, it does take time for people to gain expertise, and here in Frontier, we have the expertise to do it, so we've started doing it. Otherwise, it is, as time goes by, it will increase in popularity, and more leadless will be inserted, and
it will be really helpful for people who goes through the procedure, I guess, rather than having all the...
Yes, I think that is the whole part, because when you put a traditional pacemaker, the patient has to stay in the hospital for 2 to 3 days just to see that there's no bleeding, no infection. Then probably keep their hands, the movement of their hand to be restricted, simply because they want their incision to heal. And sometimes even some patients end up with frozen shoulders because they cannot move their hand, they've not moved their hand enough, and pain because of that. That is where this leadless completely is very good, because you have no problem. You just can start moving the very next day, because all you've done is put an injection into your thigh. It's just like taking a TT injection or any other injection that you take normally, a vaccination. You just take a leg and then next day you're free to move. So that is probably where leadless really is helpful, because the patient's comfort is huge in that.